My name is Sean Schweitzer, and today I'm going to be talking about cardiovascular disease in African American women aged 25 to 45. As I said, my name is Sean Schweitzer, and I am a graduate student representing the University of Indianapolis. The third International Conference on Cardiovascular Diseases and Therapeutics will be hosted in Paris, France on April 1st through 2nd of 2020 of this year. It'll be focused on innovation in the field of cardiology research with updates on areas such as cardiovascular diseases and cardiovascular therapy. The theme of this conference is novel perspectives on clinical cardiology and heart disease, which is the platform that I wish to present this information on because it revolves around the topic of cardiovascular disease and other health-related issues to this. This conference platform provides the opportunity to present a worldwide health issue at an international level, and it will allow different perspectives from other nationalities and insight from other health professionals and scientists from various places across the world. From this conference, important knowledge will be gained about cardiovascular disease from other health professionals and will apply to this intervention implemented and work with this health problem, as well as provide resources that can assist in the implementation of my intervention appropriately. Along with this, there will be various stakeholders attending this conference who could be valuable assets and resources to the intervention. And these stakeholders may include anyone from the American Heart Association, Indiana Minority Health Coalition, other researchers working on cardiovascular related research, and even policymakers from the U.S. government. Presenting at this conference will help overall in learning in the best possible way to implement this intervention on cardiovascular disease prevention, and will help the chosen target population through the learning and use of evidence-based information and practices. Furthermore, by the conclusion of this presentation, there are two key points that should be taken away from this. The first one is that cardiovascular disease is the leading cause of death worldwide and continues to stand in first place, unfortunately. Second, this is a disease that affects many individuals, but especially can be seen in minority populations, and it is a current problem that needs to be addressed. The non-communicable disease that has been chosen to focus on is cardiovascular disease. According to the Mayo Clinic, CVD, cardiovascular disease, refers to conditions that involve narrowed or blocked blood vessels that can lead to a heart attack, chest pain or angina, or stroke. CVD can affect virtually anyone, no matter what race, gender, ethnicity, sex, and is one of the biggest contributors to chronic health issues around the entire world. Considering CVD is the leading cause of death worldwide, with approximately 17.3 million people who die annually from this disease and from complications of CVD. It's also expected to grow to 23.6 million or greater deaths by 2030. Just to illustrate this and illustrate how detrimental CVD is on a global population, it kills more people than all of the various types of cancers combined together. As for prevalence, though, approximately 85.6 million individuals in the US alone live with CVD. And according to the Centers for Disease Control and Prevention, from a statewide perspective, Indiana is ranked 13th out of the 50 states for heart disease, since it is the leading cause of death in the state, with 14,445 people dying in 2017 from this form of CVD. Along with this, according to the CDC, Indiana has a CVD death rate of 553.2 deaths per 100,000 for African Americans. And then this is compared to whites who have 463 deaths per 100,000. So we can see here that county-wise, also, Marion County shows a CVD death rate of 416 deaths per 100,000 for African Americans, whereas for whites, it is around 343 deaths per 100,000. and this was determined by the Indiana State Department of Health. But right here alone, we see that CBD is killing more significantly higher numbers of minorities, but more specifically African Americans compared to whites. So this is something that has been noted throughout the research process on this. Because CBD causes so many issues and harmful impacts on the world's population, it is necessary to find ways to prevent this health issue from occurring, as well as discover ways for affected individuals to be able to maintain and manage its health effects. It was explained that CBD continues to rise in prevalence, as well as is expected to cause more deaths than we see today as time goes on. However, not only is the future of CBD a problem, but currently the awareness of CBD is an issue because the awareness of CBD risk factors is not as high as it should be, considering how common this non-communicable disease is, and the risk awareness is not even uniform across all races and genders, with women and ethnic minorities showing less awareness compared to whites. What creates additional issues is that even healthcare providers don't seem to be fully grasping just how pertinent this issue is for certain demographics and populations, with some providers assigning lower CBD risk category factors to women and ethnic minorities compared to men, even though they had similar risk factors that were present. The problems with CBD must be addressed in an appropriate manner, though, because factors such as the rising prevalence and lack of awareness are hindering the opportunity to make a positive change with this non-communicable disease. The importance of this and the importance of prevention of CBD applies to all aspects and all populations affected, but there are certain populations that are impacted a bit more than others. For instance, women, ethnic minorities, and low-income populations are more at risk for CBD than their counterparts. Additionally, though, health-wise, the populations who have obesity, diabetes, hypertension, lack physical activity, eat poorly, and/or use tobacco all are at greater risk for CBD compared to those who do not have these health problems. For the symptoms of CBD, these can include chest pain, shortness of breath, weakness in limbs, or pain in the neck, throat, or torso. These are the more commonly seen characteristics and symptoms that can lead to CBD, but there are others as well. Moreover, CBD can be developed through different methods, but commonly CBD will develop from damage to the heart or blood vessels, and this is called by what is called atherosclerosis, which is the continuous buildup of plaque that slowly begins blocking the movement of blood flow throughout the body, leading to issues such as CBD. Not only is the development important, but the effects of CBD have a major impact on the individual's health and body, such as causing heart failure, heart attack, stroke, aneurysms, and sudden cardiac arrest. Although this NCD is damaging to the global population, it is very interesting because of how it works and the inclusion of all of its risk factors attributes to it and how it works. It was chosen for this reason, and because seeing a positive outcome result from this intervention would be magnificent. After researching the background on CBD and previous health interventions implemented for this, it was decided that the most effective method would revolve around a health education program that educates individuals, promotes healthy lifestyle habits, and provides meaningful resources for assistance in fighting against CBD. This intervention is most beneficial to the chosen target population and can provide an environment that is not only educational, but is also fun for participants. The program will be 4 to 6 weeks in length, and depending on the availability of resources, it will meet 2 times per week. One day will be an educational day on topics such as how to cook healthy meals and eat healthier, as well as background on what CBD is. The other day will be a physical activity day in which participants will complete some sort of physical activity, which will include things such as walking and running. Very simple, basic physical activity exercises that they can do virtually anywhere. and this will be led by a certified health educator. Activities will not only be completed during class time, but there will be take-home materials used as well, so that these participants can look at them outside of the program and have a reference for even when the program ends, to continuously be able to look at these materials to help them remember how to work around CVD. But one of the key takeaways from this program is that there should be knowledge and information that can be utilized by these participants even after the program is concluded. As long as they understand the information and feel a method of self-efficacy that they can use to help boost them into a healthier lifestyle even after the program is done, this is one of the biggest tasks for this program. So in conclusion, the background of CVD and the attribution of this background to the intervention is important because it's necessary for people to understand the prevalence of CVD and the overall need for programming related to this health behavior. And in order for these changes to occur in the population, there has to be methods in place such as this one to help them. The focus on this specific CVD intervention was made because it is an intervention that promotes activity and creates a fun environment that can encourage participation as well as improve the health of these individuals at the same time. Furthermore, the geographic area that this intervention will be completed in is the area around the University of Indianapolis, which there are various parks and playgrounds around Indianapolis that can be utilized for programs such as this. And this is an area that could be valuable considering many individuals can benefit from an intervention that is focused on improving and maintaining their cardiovascular health. For this intervention, African American women aged 25 to 45 are the best population to focus on for this health issue specifically. CVD is the leading cause of death among racial groups such as African Americans, contributing to 1 in 4 deaths each year. CVD affects 44 million African Americans yearly, and this same racial group depicts a higher prevalence of hypertension as well, compared to that of whites. Obesity, which is a common factor of CVD, is prevalent in African American women, showing more than 50% being classified as obese. And as for women, CVD is the leading cause of death for over 15,000 women aged 55 and younger in the U.S. annually. But moreover, this population would be likely to adopt the health behaviors being focused on in this intervention. Although CVD has decreased in prevalence among women aged 65 and older, women aged 55 and younger still show stagnation in improvements of the disease, meaning that it's not moving, people are not actually improving in health, and this disease is not going away anytime soon because of that. The prevalence of CVD is high among African American women aged 25 to 45, with 42.9% of African American women having high levels of hypertension and 48.3% having high levels of CVD. Because only 11.2% of African American women meet the appropriate guidelines for physical activity, many of these women are lacking the associated health and cardioprotective benefits. Additionally, African American women have poor blood pressure control that tend to have a higher African American women with poor blood pressure control tend to have a higher prevalence of hypertension and as a result more CVD related health issues. And almost half of all African American women in the US have an issue with CVD or related health effect. And there is low awareness of CVD's significance among women and healthcare providers. So due to this background, this target population was selected, with one of the main reasons being that there were relatively slow improvements being made for their health in the realms of CVD, depicting many from this population continuing to suffer from CVD's negative health effects and also awareness being still too low and needing to be increased overall. After all, African American women are at an increased risk of morbidity and mortality as both a direct and indirect comparison and result of CVD. Therefore, with this being stated, this target population would benefit from this intervention being implemented in various aspects. Some specific risk factors for the target population include obesity and hypertension. Obesity plays a vital role in the prevalence of CVD because if an individual is obese, it can lead to issues such as CVD. Within this risk factor, what can contribute to obesity is lack of physical activity and/or an unhealthy diet. Less than 1% of adults in the U.S. are able to meet the American Heart Association's idea of an ideal and healthy diet. And according to Brennan and Williams, African American women are lacking the appropriate amount of physical activity, and their overall health behavior tends to be influenced by social norms, which adds another layer of difficulty in lowering the risk of CVD in this population. Now, this behavior's influence on the lifestyle of this population makes the need for a culturally appropriate intervention to be implemented. And so before this intervention is talked about, it should be understood that for minority populations such as this one, issues such as higher poverty rates, lower levels of education, and limited access to healthcare services can pertain to the prevalence of health issues such as CVD and its risk factors. Now, obesity will be the main risk factor that is addressed in this intervention, with the subtopics of physical activity and diet being looked into. Because lifestyle social norms are so common in this population, these behaviors will be considered when implementing the intervention. The reasoning for choosing these factors is because they would be the most pertinent to the type of activities in the interactive intervention that will be implemented, meaning they could be easily targeted and improved for a healthy outcome for participants. And this would be done through participant feedback and consistent evaluation, using this feedback to adapt and change the program and make it more accessible and more addressable to the needs of the participants. Previous interventions have been done to focus on this health issue, with one being a very simplistic yet successful approach at targeting this health issue. It took into account how beneficial walking can be on cardiovascular health. And this study by Murtaugh and colleagues analyzed various walking interventions that lasted at least 4 weeks or greater across multiple databases, in which it was discovered that between a control group of inactive participants and a treatment group of individuals who walked as the only treatment, those who walked showed positive health outcomes compared to those who were inactive. There was also an increase in aerobic capacity, as well as a decrease in blood pressure, waist circumference, weight, body fat percentage, and body mass index, or BMI. As a result of conducting the study, walking was found to be an appropriate risk reducer for CVD and other health problems, as well as a beneficial activity to promote overall health in a fun and simplistic way. A second intervention that has been done was explained in a study by Para Medina and colleagues, which experimented on an ethnically relevant lifestyle trial. In this trial, 266 low-income African American women aged 35 years and older were assigned to one of two groups, a comprehensive care intervention or standard care intervention group. The comprehensive care intervention had participants receiving what those in the standard group received, which included counseling and goal setting, plus a year of telephone counseling and newsletters tailored to suit their needs. What was determined from this intervention was that those in the comprehensive care group had better health outcomes than those in the standard group when it came to physical activity done during their leisure time, but did not show a significant change in total physical activity output. This intervention was positive in the aspect that it was useful in reaching a population that is difficult to assist when it comes to health behavior change, but a limitation of this intervention was that a control group should have been added in order to see more significant differences in results between the other two intervention groups and the control group. These prior interventions shed some light on the possibilities that can lead can be used when focusing on an intervention for health change behavior with CVD. And all of these aspects were taken into consideration when creating this specific intervention. For this intervention, resources that will be needed will include the following: an instructor who is familiar with CVD and what individuals can do to lower their risk for it. This will be a health educator. A built environment, such as a park, which will be Garfield Park being used, and then Garfield Park's community center, because that way the park itself can be used for the physical activity day, and the community center can be used for the cooking and the instructional day. So both those purposes are met. And there will also be needed are tables and chairs for the instructional days, and then pencils and paper, which will be bought from a local Dollar Tree. This intervention fits into the target population because the population includes African American women who are aged 25 to 45, meaning they are still relatively young and there are varying demographic aspects. Due to this, intervention must be able to address their needs in a way that will keep them interested. And it fits with this target population because the built environment outside of University of Indianapolis's campus is not always the most accessible, so physical activity can be sometimes limited. But the CVD prevention intervention educates individuals in a way that will teach them how to complete a task, and then they can perform the task themselves so that they can practice self-efficacy to use outside of the program itself. Considering education and the demographics of the population is on the lower end, this intervention will provide guidance on how to sustain a healthy lifestyle. And with this being stated, assessments of the target population and geographical location was reached through observation and knowledge about the area, mixed with research on the target population and their needs. This allowed in the ability to choose where in Indianapolis would be a viable location to implement this intervention. And evidence supports the use of this intervention method as a great way to prevent NCDs. And this stems from various studies and interventions that had been researched prior to the intervention. For example, with both of the prior interventions done that was spoken about in the previous slides, they both had successful outcomes on physical activity and overall health of their participants, and this will do the same. But with both of these interventions, they were also seen as inexpensive and sustainable methods for combating CVD and other NCDs related to it, as this one will be as well. According to Brennan and Williams, the inclusion of methods in intervention is very important, and attaching social norms can influence the adoption of an intervention, as well as can just help with an intervention's success overall. This can be seen in this intervention, for it is inclusive and laid out in a way that promotes active participation and consistent feedback from participants. And even though it was discussed how similar previous interventions and ideas have influenced the methods of this is being done on a smaller sample population, meaning people in the intervention can be reached more appropriately with it being smaller. People's needs can be met this way as well. But also includes an area that is focused on cooking healthy meals inexpensively, so it's something that some other prior interventions neglected to do. This specific intervention depicts a useful way of facing the issues of CVD in the target population. Because, for instance, the target population faces environmental and health barriers that can hinder progress. And according to Barber and colleagues, being able to access healthy foods in areas for physical activity safely is not always available to them because of the location they're in. But also the lack of social cohesion in these unsafe neighborhoods can attribute to poor health outcomes such as obesity, hypertension, and diabetes. But also, according to Mers and colleagues, other factors can attribute to this as well, such as access to healthcare services, having a stable job, and education level. Lower education levels and income can also attribute to health issues with obesity, hypertension, and CVD alike. But even for those who do have access to a healthcare provider, many physicians lack awareness of the high levels of CVD for African American women. So this is all addressed in this intervention. What is understood with this population is that they are at high risk due to factors such as the lack of access to healthcare services, healthy food, physical activity, as well as a stable job and education. This population also suffers because there are social influences that influence their decisions on things such as this, and it can block them from making beneficial health improvements, which includes these social influences include family, neighborhoods, and friends. Residential segregation and an overall lack of social cohesion can contribute to these negative social influences, which cause a negative outcome for health and other factors such as CVD. Because there is a disparity in gender and race, and since this population is comprised of African American women, there is a gap in care and awareness compared to other races and genders that needs to be addressed. These underlying factors are a barrier to the target population, but this intervention specifically addresses overcoming these barriers by having an all-inclusive setting that is centralized so participants have the neighborhood surrounded around this area and can easily access Garfield Park. This will also be good because these participants can provide consistent feedback, which will help manage and maintain the program. And it's done through a watch and do approach so that they can see how to do something and then perform it themselves. This will just create an overall helpful learning environment that can help them understand how to cook and how to exercise appropriately, and it can help them practice self-efficacy so that even after the program is over, they can still continue to sustain a healthy lifestyle. Having key stakeholders can help bring an intervention to fruition, and therefore some other stakeholders who would be valuable to this intervention would be the Indiana Minority Health Coalition because of their background and work with disparities among minority populations across all of Indiana, but also SoIndy's Quality of Life Plan because they are successful with their work around the University of Indianapolis's campus in the surrounding area around that. They have done a lot with this and they know the community inside and out, which will help as well. But both of these deal with health disparities and food access issues. So with this being stated, both could be able to beneficially contribute to this intervention and to this health issue so that their expertise and understanding can be used as a basis for fixing this problem around Indiana and around Indianapolis specifically. Attending the Third International Conference on Cardiovascular Diseases and Therapeutics would be an excellent opportunity to connect with other health professionals and scientists focusing on CVD, because not only would it provide knowledge and experiences from various individuals and with different backgrounds across different nations and cultures, but it also just gives support to the CVD prevention intervention that could also be used to help focus on this prevention in the target population. Being able to reach and gain support from stakeholders such as the Indiana Minority Health Coalition, American Heart Association, U.S. policymakers, and cardiovascular researchers would be very beneficial to this intervention and to this topic in general. And because each play a pivotal role in such issues with CVD, and all of them give their own aspects to the table, bring their own aspects to the table that can be beneficial to this. But also, conference members can take action and learn more about CVD and how it applies to their community so they can go back after the conference and they can advocate for change in this area, and they can do things themselves to help improve these issues around the world. In conclusion, to addressing the issue of CVD in African American women aged 25 to 45, it should be understood that CVD can affect virtually anyone. So more specifically, it has a high prevalence among minorities such as African Americans, and even among genders and gender differences between males and females. So knowing the risk factors for CVD is important to everyone, not just those at risk, because virtually anyone can succumb to it. So we need to be well informed and knowledgeable on how to prevent it so that we can prevent it in ourselves and those around us. But also, underneath these risk factors are broader factors that can influence influence these risk factors, and these may include social determinants of health, such as access to healthcare services, healthy foods, physical activity, education, economic stability, and geographic location. They're always roots to the causes, and with these health issues, because it can be so broad, we need to be able to create interventions that can address these problems. Therefore, the intervention of a program lasting 4 to 6 weeks and being implemented twice a week is a viable choice to work against CVD in the target population, because it would use culturally and socially acceptable methods tailored for the target population. The intervention would have a main focus on self-efficacy, and with this, allow for both education and application of what is learned in an environment that is safe and centralized for participants to easily access it. After the conclusion of the program, participants can take away what they learned to be able to use this knowledge to successfully sustain a healthy lifestyle, a lifestyle that could prevent the onset of other health issues related to CVD and other non-communicable diseases alike. Thank you for listening to my presentation. I hope you all have a great day.